We are back with Dr. Theodore Manny here, a urologist with Cone Health, and we are talking about what you need to know when it comes to prostate cancer. Dr. Manny, let's pick up right where we left off. So Cone Health Cancer Center, you all have a free prostate cancer screening event coming up. Let's hear all about it.
Sure. So actually on Monday, April 29th, from 9 a.m. to 1 p.m., we are hosting a free screening event for men. This is open to all men ages 45 to 69 who have not had screening within the last year. This is being held at actually the Women's Health Building at 930 3rd Street in Greensboro. It is a free event. We encourage all men to come, again, age 45 to 69. It is free, but we do have to register ahead of time. Registration information, we can find that at conehealth.com/prostate cancer. And from there, that'll take you to the registration for the event. Again, that's on April 29th from 9 a.m. to 1 p.m.
All right, seems like a really great event there. Now, does an elevated PSA level always mean cancer?
Fortunately not. The PSA blood test, even though it's the best thing that we have, it's actually pretty crude, and there's lots of false positives. Fortunately, 70% of the time, men do not have prostate cancer who have an elevated PSA. Now, that can still mean that there's other issues, such as significant prostate enlargement or other urinary tract problems that need to be addressed. But fortunately, to answer your question, Sydney, it does not always mean a man has prostate cancer.
Okay. Now, while there's no sure way to prevent prostate cancer, what steps can men take that would help lower their risk?
Two big things, and they're actually applicable to most cancers. The first is just limiting tobacco use as much as we can. The second is really trying to maintain an ideal body weight. When we carry around extra weight, that actually tends to increase the risk of multiple cancers, and prostate is one of those. So, trying to keep an ideal body weight and limiting tobacco, those are the two big things that we can do lifestyle-wise to lower our risk.
Okay. Now, some people put off going to the doctor. How concerning is that with respect to prostate cancer?
That's something that we see as a problem all the time. Us men are pretty bad about going to the doctor. We all are. We're a little bit disadvantaged there in that our lady colleagues, they tend to be more used to seeing their OB-GYN every year, starting at a pretty young age. Men really don't have that. So we tend to be, not as good about getting in the routine of seeing our primary care doctors or other providers. And it is really critical for men to do that, especially, establishing with a good primary care doctor around age 40 or so is great for overall health. And prostate screening, they'll do a good job of bringing that into the mix at around age 45 when that's recommended.
What's a common misconception about prostate cancer?
There's two big ones. The first one that we see is that prostate cancer only affects older men, and that's just not true. Again, it does tend to affect men in their middle age as well. It's not just disease of much older men. The second one is that there's a misconception that treatment for prostate cancer always has to be scary or unpleasant, and that's just not the case. I'm very proud that our providers in the Cone Health system, they make treatment individualized. And so it's all about finding the patient's priorities and coming up with a custom treatment plan that's really aimed to their specific case, looking at their goals, their priorities, and at the overall aggressiveness of the cancer. It does not necessarily have to be a scary process at all.
All right, in about 20 seconds, what's your final message you want to share about prostate cancer?
That's easy, and that's just get screened. Go ahead and do the screening.
All right, thank you so much, and thank you again for joining us today. If you missed any of this To Your Wellbeing conversation on prostate cancer, you can rewatch this segment, of course, on our website, WFMYnews2.com. All you have to do is click on the To Your Wellbeing tab. Now let's get a